1. When getting ready to make a bed, the nurse aide should place the clean linens on A. A chair or table beside the bed. B. The roommate's bed. C. A clean surface in the bathroom. D. The floor beside the bed. The correct answer is A. 2. The only purpose for using a restraint is to A. Ensure the safety of the client or others. B. Make the nurse aide's job easier. C. Calm a client who is verbally abusive. D. Help the client be quiet. The correct answer is A. Ensure the safety of the client or others. 3. Articles contaminated with blood or body fluids should be disposed of in the A. Soiled linen basket. B. Biohazard container. C. Soiled utility room. D. Client's room trash container. The correct answer is B. Biohazard container. 4. To avoid pulling the indwelling urethral catheter when turning a client, the catheter tubing should be secured to the client's A. Bed sheet. B. Upper thigh. C. Bed frame. D. Hip. The correct answer is B. Upper thigh. 5. When collecting a 24-hour urine sample for a client, the nurse aide should request that the client A. Take a bath or shower before starting the urine collection. B. Select food items that do not contain red meat. C. Drink 2 liters of water. D. Discard the first voided urine. The correct answer is D. Discard the first voided urine. 6. When ambulating the client, the nurse aide should A. Ask the nurse for help. B. Be sure the client is wearing non-skid footwear. C. Ask a family member for assistance. D. Walk in front of the client and show the client the way. The correct answer is B. Be sure the client is wearing non-skid footwear. 7. Which of the following is the best personal protective equipment item for the nurse aide to wear when handling infectious waste that could splash or spray? A. Shoe covers. B. A mask. C. Goggles. D. A face shield. The correct answer is D. A face shield. 8. Which of the following would be an appropriate response for the nurse aide to make if a client expresses anger during care? A. Why are you being so mean today? B. You should not say such mean things to people. C. I will come back when your bad mood is over. D. You seem upset. Would you like to talk about it? The correct answer is D. You seem upset. Would you like to talk about it? 9. The nurse aide has raised the height of the client's bed to provide care to the client, but the nurse aide forgot to bring the supplies needed. What should the nurse aide do next? A. Instruct the client to lie still. B. Quickly go to get the supplies. C. Lower the bed and place the call light within reach. D. Ask the roommate to watch the client while the nurse aide gets the supplies. The correct answer is C. Lower the bed and place the call light within reach. 10. A client requests that the nurse aide call the client's spiritual advisor. The nurse aide should A. Ask the client why the client wants the nurse aide to call the client's spiritual advisor. B. Tell the client that this is not part of the nurse aide's job. C. Tell the client that the nurse aide will inform the nurse of the client's request. D. Call the spiritual advisor for the client. The correct answer is C. Tell the client that the nurse aide will inform the nurse of the client's request. 11. A client wakes up during the night and asks for something to eat. The nurse aide should A. Check client's diet before offering nourishment. B. Tell the client nothing is available at night. C. Explain that breakfast is coming in 3 hours. D. Tell the client that eating is not allowed during the night. The correct answer is A. Check client's diet before offering nourishment. 12. The nurse aide is preparing to bathe the client. What should the nurse aide do first? A. Test the temperature of the water. B. Help the client undress. C. Tell the client what the nurse aide is going to do. D. Close the door and windows. The correct answer is C. Tell the client what the nurse aide is going to do. 13. When making a bed that is occupied by a client, the nurse aide should A. Leave the bed in the lowest position. B. Make the toe pleat. C. Leave the bottom sheet untucked. D. Place soiled linens on the floor. The correct answer is B. Make the toe pleat. 14. Frequent turning and repositioning of the client helps prevent A. Cyanosis. B. Indigestion. C. Coronary disease. D. Pressure injuries. The correct answer is D. Pressure injuries. 15. When applying elastic stockings to the client, it would be best for the nurse aide to position the client A. Lying down in bed. B. Dangling the legs from the edge of the bed. C. Standing at the side of the bed. D. Sitting in a wheelchair. The correct answer is A. Lying down in bed. 16. The nurse aide is in the employee dining room. A group of nurse aides are eating lunch together and begin discussing how rude a certain client was acting. The nurse aide should A. Join in the conversation. B. Suggest that this is not the place to discuss the client. C. Be quiet and not say anything to the other nurse aides. D. Return to the unit and tell the client what was said. The correct answer is B. Suggest that this is not the place to discuss the client. 17. The client signaling device should be placed A. On the bed. B. Within the client's reach. C. On the client's right side. D. Over the side rail. The correct answer is B. Within the client's reach. 18. When helping a client who is recovering from a stroke to walk, the nurse aide should assist A. On the client's strong side. B. On the client's weak side. C. From behind the client. D. With a wheelchair. The correct answer is B. On the client's weak side. 19. A client who is confused begins to cry and scream out for the client's parent. What should the nurse aide do next? A. Place the client in a geriatric chair. B. Restrain the client in his bed. C. Talk to the client in a calm voice about familiar things. D. Leave the client alone in his room until he calms down. The correct answer is C. Talk to the client in a calm voice about familiar things. 20. Which of the following actions would be best for the nurse aide to take to show respect to the spiritual needs of a client? A. Escorting the client to religious services. B. Discussing the nurse aide's religion with the client. C. Assisting the client to read the client's religious materials. D. Requesting that the facility's spiritual advisor visits the client. The correct answer is C. Assisting the client to read the client's religious materials. 21. While the nurse aide is providing care to the client calls the nurse aide by the name of the client's child, who died several years ago. The nurse aide's best response would be to A. Quickly finish providing care and leave the client alone. B. Pretend to be the client's child. C. Ignore the client because the client is confused. D. Ask the client about the client's favorite memories of the client's child. The correct answer is D. Ask the client about the client's favorite memories of the client's child. 22. When providing care for a client receiving oxygen therapy, the nurse aide should A. Check ears for pressure points, B. Tape cracks in oxygen tubing, C. Let the nurse know that the nurse aide cannot care for the client, D. Change the flow rate if the client is short of breath. The correct answer is A. Check ears for pressure points. 23. A client falls and suffers a deep cut on the forehead. What should the nurse aide do next? A. Take the client to the hospital, B. Help the client back to the bed, C. Take the client into the bathroom to wash out the cut, D. Stay with the client and call for help. The correct answer is D. Stay with the client and call for help. 24. The client has been sad and depressed since being admitted to the facility yesterday. What would be the best thing for the nurse aide to do for the client? A. Arrange for the client's spiritual advisor to visit the client, B. Turn on the television in the client's room and leave the client alone, C. Force the client to take part in facility activities, D. Introduce the client to other clients and staff members. The correct answer is D. Introduce the client to other clients and staff members. 25. The nurse aide is asked by a client who is confused what day it is. The nurse aide should A. Explain that memory loss is natural and the date is not important, B. Ignore the request, C. Point to the date on a calendar and say the date, D. Provide the date and then test the client later. The correct answer is C. Point to the date on a calendar and say the date. 26. Which of the following is most important for the prevention of skin breakdown in the client? A. Air drying the client's skin, B. Rubbing lotion on the client's skin, C. Ambulating the client once a day, D. Repositioning the client every 2 hours. The correct answer is D. Repositioning the client every 2 hours. 27. When caring for a client who is dying, the nurse aide should A. Only allow one visitor in the room at a time, B. Keep the room dark at all times, C. Pay special attention to fluid intake and mouth care, D. Wear gloves when providing personal care. The correct answer is C. Pay special attention to fluid intake and mouth care. 28. To best communicate with a client who has total hearing loss, the nurse aide should A. Smile frequently and speak loudly, B. Smile often and talk rapidly, C. Avoid eye contact, D. Write out the information. The correct answer is D. Write out the information. 29. When a client who is weak and unable to move without assistance is positioned in a chair, the nurse aide should A. Check on the client every 5 minutes, B. Make sure the client's water pitcher is full, C. Protect the client with a seat belt, D. Place the signaling device within the client's reach. The correct answer is D. Place the signaling device within the client's reach. 30. What would be the best way for the nurse aide to promote client independence when bathing a client who had a stroke? A. Give the client a complete bath only when the client requests it, B. Encourage the client to do as much as possible and assist as needed, C. Leave the client alone and assume the client will do as much as the client can, D. Limit the client to washing the client's hands. The correct answer is B. Encourage the client to do as much as possible and assist as needed. 31. Which of the following methods is the correct way to remove a dirty isolation gown? A. Pull the gown over the head, B. Let the gown drop to the floor and step out of the gown, C. Roll the gown dirty side in and away from the body, D. Pull the gown off by the sleeve and shake the gown out. The correct answer is C. Roll the gown dirty side in and away from the body. 32. The healthcare team member who assists the client with the performance of activities of daily living is the A. Social worker, B. Occupational therapist, C. Speech therapist, D. Case manager. The correct answer is B. Occupational therapist. 33. What does ambulate with assistance mean? A. Walk with the client twice a day. B. The client may use a wheelchair. C. Have the client use a cane for walking. D. The client can walk with a nurse aide providing help. The correct answer is D. The client can walk with a nurse aide providing help. 34. When transferring a client, most of the client's weight should be supported by the nurse aides. A. Back, B. Shoulders, C. Legs, D. Wrists. The correct answer is C. Legs. 35. When changing a soiled dressing, the nurse aide should wash the nurse aide's hands. A. Before the procedure, B. After the procedure, C. Before and after the procedure, D. Before, during, and after the procedure. The correct answer is D. Before, during, and after the procedure. 36. The nurse aide must wear gloves when A. Transferring a client, B. Providing mouth care, C. Dressing a client, D. Weighing a client. The correct answer is B. Providing mouth care. 37. When assisting a client who has right-sided weakness to transfer from a wheelchair, the nurse aide should support the client's A. Left side, B. Right side, C. Front side, D. Back side. The correct answer is B. Right side. 38. The nurse aide can help prevent pressure injuries in the client by A. Repositioning the client every 4 hours, B. Massaging reddened areas on the client's skin, C. Keeping linens clean, dry, and wrinkle-free, D. Using perfumed soap to clean the client's skin. The correct answer is C. Keeping linens clean, dry, and wrinkle-free. 39. If a nurse aide discovers a small fire in a client's room, the nurse aide should first A. Sound the alarm, B. Contain the fire, C. Remove the client from any danger, D. Extinguish the fire. The correct answer is C. Remove the client from any danger. 40. When a client has memory loss or confusion, the nurse aide should A. Reassure the client that forgetting information is expected with age, B. Speak loudly to the client, C. Ignore the client's statements that are not accurate, D. Give the client simple step-by-step instructions. The correct answer is D. Give the client simple step-by-step instructions. 41. What does the abbreviation ADL mean? A. Ad-lib, B. As doctor likes, C. Activities of daily living, D. After daylight. The correct answer is C. Activities of daily living. 42. Which of the following actions should the nurse aide take to communicate with a client who has a hearing loss? A. Face the client when speaking, B. Repeat statements twice every time, C. Shout so that the client can hear you, D. Use a high-pitched voice. The correct answer is A. Face the client when speaking. 43. What is the first area of a client's body that the nurse aide should wash when providing a bed bath? A. Legs, B. Face, C. Arms, D. Chest. The correct answer is B. Face. 44. When a nurse provides the nurse aide confidential information about a client, the nurse aide should A. Share it with other clients, B. Keep the information private, C. Discuss the information with other staff members in the break room, D. Discuss the information with the client's family. The correct answer is B. Keep the information private. 45. Before entering a client's room, the nurse aide should first A. Turn lights on. B. Identify self. C. Knock on the door. D. Call the client by the client's name. The correct answer is C. Knock on the door. 46. Mouth care for a client who is unconscious must be done every A. 2 hours. B. 4 hours. C. 6 hours. D. 8 hours. The correct answer is A. 2 hours. 47. The nurse aide should place the client's soiled bedsheets A. On the bedside table. B. On the floor of the soiled utility room. C. In a biohazard bag. D. In the soiled linen container. The correct answer is D. In the soiled linen container. 48. Before taking the oral temperature of a client who has just finished a cold drink, the nurse aide should wait A. 20 minutes. B. 25 to 35 minutes. C. 45 to 55 minutes. D. At least 1 hour. The correct answer is A. 20 minutes. 49. To prevent dehydration of the client, the nurse aide should A. Offer fluids frequently while the client is awake. B. Wake the client hourly during the night to offer fluids. C. Give the client frequent baths. D. Feed the client salty foods to increase thirst. The correct answer is A. Offer fluids frequently while the client is awake. 50. When preparing to take a meal tray into the client's room, what is the most important action for the nurse aide to take? A. Check that the client's name is displayed on the tray card. B. Make sure the client's favorite foods are present. C. Determine if enough fluids have been ordered. D. Keep all foods covered until eaten. The correct answer is A. Check that the client's name is displayed on the tray card. 51. Which of the following equipment should the nurse aide have available when caring for a client's beard? A. Basin, mirror, nail file and towel. B. Towel, gloves, razor and shaving cream. C. Shaving cream, razor, gloves and comb. D. Razor, shaving cream, towels and orange stick. The correct answer is B. Towel, gloves, razor and shaving cream. 52. To find out what type of diet the client should be receiving, it would be best for the nurse aide to check A. With the kitchen staff. B. On the client's room bulletin board. C. In the client's care plan. D. With the client's family. The correct answer is C. In the client's care plan. 53. What should the nurse aide do when a client with Alzheimer's disease seems depressed and quiet? A. Talk when the client is silent. B. Observe the client for nonverbal cues. C. Change subjects until the client begins to discuss something. D. Tell the client not to worry. The correct answer is B. Observe the client for nonverbal cues. 54. Which of the following actions by the nurse aide can best demonstrate active listening skills? A. Changing the subject frequently. B. Responding when appropriate. C. Correcting the client's mistakes. D. Directing the conversation. The correct answer is B. Responding when appropriate. 55. The nurse aide should understand that a back massage A. Causes muscle spasms. B. Increases blood pressure. C. Promotes circulation. D. Increases the heart rate. The correct answer is C. Promotes circulation. 56. When assisting with dressing a client who has left-sided weakness, what part of a sweater should be put on first? A. Both sleeves. B. Left sleeve. C. Client's choice. D. Right sleeve. The correct answer is B. Left sleeve. 57. A client with arthritis reports difficulty when cutting the food. What should the nurse aide do to encourage the client's independence in eating? A. Cut the food and feed the client. B. Insist that the client eat the meal without help. C. Assist the client in cutting the food and encourage the client to use the special eating utensils. D. Ask the dietary department to puree the client's food. The correct answer is C. Assist the client in cutting the food and encourage the client to use the special eating utensils. 58. The nurse aide is assisting a coworker in obtaining a quad cane for a client. How many legs should the nurse aide understand that a quad cane has? A. 1, B. 2, C. 3, D. 4. The correct answer is D. 4. 59. Once a client has been pronounced dead, the responsibility of the nurse aide is to A. Make sure the body is clean. B. Call the family. C. Leave the room. D. Give spiritual care. The correct answer is A. Make sure the body is clean. 60. A client drinks 240 ml of soup, 120 ml of coffee, and 90 ml of juice for lunch. The client's total liquid intake for lunch is A. 360 ml, B. 450 ml, C. 480 ml, D. 520 ml. The correct answer is B. 450 ml.